All right, we're gonna go ahead and get started. And it's been a bit under 2 hours, I think, on electrocardiography. And this year we're going to really focus in on cardiac ischemia. Now, some people were mentioning that the handout apparently didn't get printed for the syllabus there, but don't worry about it. You're probably fine without the handout, and I'm going to put all of the slides that we're going to go through over the next couple of hours on our residency website for you to download, and I'll show you the link for that in just a moment. While people are still filtering in, I just want to start out with some pictures of where I work. This is downtown Baltimore, and every year I keep trying to convince Mel to bring Essentials out to Baltimore. He's convinced nobody would come. I would. So how many of you have been to Baltimore? All right, so great city, I'm sure. Many of you know Baltimore for one of many things. A lot of people have this image of Baltimore as a really dangerous city, so Baltimore has been trying to do a lot of things to reverse the image, and they've been bringing in these big events. The most recent big event that's come to Baltimore is the Grand Prix, and so for those of you that are Formula One race car fans, you come to Baltimore, and this is held around Labor Day every year, and it's going to be there for the next few years. I didn't think they could pull this off, but they actually build these giant fences around the Inner Harbor area. Where's my cursor? They build these giant fences around the Inner Harbor area, and amazingly, they have these cars whizzing around at 150, 200 miles an hour, and they have the stands up there. Now, it was interesting to note that this is the race car track, and last year, the good folks from ESPN were quick to point out that the shape of the race car track in Baltimore is shaped like a handgun. So I thought, well, great, no one's going to come to Baltimore now. But fortunately, our local newscasters came to the defense, and they said, if you look at the thing on the far right, that little handle pointing out, is not a handgun, it's actually an Uzi. So, great. So just propagating the myth of Baltimore being such a dangerous place. Anyway, so welcome. We're going to spend time for the next couple of hours talking about some advanced concepts in electrocardiography. And this year we're going to really focus on myocardial ischemia and some of its mimics. And hopefully if Mel has me back next year, we'll focus more on dysrhythmias in the session next year. Now, just a few points to get started. First of all, this is intended to be advanced content, so we're not going to spend any time talking about stuff like this, all right? If there's anybody here who has any difficulty with the diagnosis up here, this is not the right conference for you, okay? So I'm sure this is about the most profound ST elevation I've ever seen. I think this person was infarcting their entire chest wall and their ski jacket as well. And just a few points to start. Normally this is a workshop. Now in a room of 1,700 people, there's probably not going to be a lot of interaction. So I put my email up here. Please email me if there's any questions at all that happen to come up. This is my home email, and it's tied into my iPhone, and I feel very neglected if I don't get at least a few emails every hour, and I check my email about 3 or 4 times an hour, I think. And don't go on our residency website and search for my email. You'll find it, but it's more of a hassle. Just use this email up here, okay? You're welcome to take notes. And again, the handout, because you don't have the handout, I'm putting the PDF for the entire slide set that we're going to go through. Wendy, do we have the mouse working, any chance? The website that you see up here, lectures.umem.org/EKG, all right? Don't put www first. Just type this in, and give me a few days to get this thing loaded up, and you'll be able to download the entire PDF for, believe it or not, the 300 or so slides we're about to go through. And I really think EKGs is best done as a visual diagnosis, and so the best way to learn EKGs is just to go through them over and over and over and over. So take advantage of this, download this PDF, and you'll be able to look through all of these slides all over again. And they'll be posted for about the next month or so. Oh, there's the cursor, but I'm not actually controlling it. So, all right. And sometimes people ask about, well, what's the gold standard? Who's the gold standard? It's definitely not me. I find that every time I open up a book, I still learn a lot more. But whenever questions come to me that I can't answer, these are the 2 authors that I go to. And if anyone is looking for some authors out there that have just written really, really great stuff. Anything that Marriott has written is worth its weight in gold, and also probably the best textbook on electrocardiography is by T.C. Chow. Both of these greats have passed away, but I think that the stuff that they have written is just really, really amazing. And also, many of you may know about this, but I've been posting every Monday an EKG Case of the Week video, and this is the website that you can go to. It's www.ekg.umem.org, and there are 10, 15-minute videos every Monday, and they go back to September of last year. So there's more than a year's worth of weekly cases that are posted there, and I'm continuing to do this. So, and if there's any cases that we don't get to in this session, you'll be able to really pick up the highlights from this website as well. So by all means, take advantage of that if you're looking for ongoing training as well. All right. So first question, why is this important? Okay. Well, this might be kind of an obvious question, but acute coronary syndrome is high risk, but it's also high payoff. To me, this is what classic emergency medicine is all about. You've got a really sick patient, but if you play your cards right, the patient has an outstanding outcome, and if you miss something, they're dead. So it's either all or nothing. And that's what emergency medicine is all about. I think there's very few other specialties in the house of medicine that have an all or nothing type of scenario, and I think that's what really makes this fun. All right. Missed MI, if you miss an MI, there's a tremendous mortality, and in the elderly, we'll talk about this tomorrow, if you miss ACS in the elderly, 50% will be dead within 3 days. And the diagnosis largely hinges on proper electrocardiography diagnosis. Well, the lawyers are out there as well, and they're always coming after not only emergency physicians, but cardiologists. These are a couple websites that just pulled up off the internet. The Heart Attack Lawyer Group, take a look at that. Lawyer groups, especially cardiology malpractice. This group focuses on cardiologists. And ACS malpractice. And these are just a couple of that you can pull off the website, but the ACS is a tremendous problem in emergency medicine. 20% of all malpractice dollars we pay out in this country is for missed MI, and probably more than 25% of cases involve ACS misreads. And these are not necessarily subtle cases, all right? These are oftentimes cases that you look at in retrospect and you say, oh my gosh, I can't believe I missed that, or so-and-so missed that, all right? And in my experience in doing medical legal consulting, I'd say at least 50% involve EKG misreads that are not really, really subtle. All right, so what we're going to do is we're going to go through a series of cases. There's about 10 cases that we're going to go through with one-line histories. We're going to talk about the EKG findings. And with each of these cases, I'm going to present multiple examples of each of these particular findings just to really, really hammer home some of these things. And everything I talk about, I think, is bordering on, well, within the clinical practice of emergency medicine. All the cases I show you are cases, real ED cases. Some of them were mine, a lot of them were screw-ups, and the majority of these are, unless they're labeled differently, they are from within our system. And some people have sent me their cases as well, and with their permission, I've put them in here as well. So